We're joined by leading consultant nephrologist, Dr. David Game. Kidney Care, the UK's leading kidney patient support charity, says that high blood pressure, also known as hypertension, is one of the biggest causes of chronic kidney disease, or CKD, in the UK, as well as uncontrolled diabetes. So today we're talking about CKD and taking an in-depth look at the connection between high blood pressure and kidney disease. Good morning, Dr. Game.
Good morning.
It's really, really nice to have you here. So could you tell us a little bit more about yourself and your work?
My name's David Game. I'm a consultant nephrologist at Guy's and St Thomas's Hospital. That's my NHS hospital. And I do private practice at the Shard and also the Lister in Chelsea. I do a full range of nephrology from chronic kidney disease through to some specialist tubular conditions, through transplantation, dialysis, etc. So I do pretty much all nephrology. And a massive part of nephrology is treating hypertension, because hypertension, as we've heard, is both a cause of chronic kidney disease and caused by chronic kidney disease. And so it stands to reason that I spend a lot of my time treating it, which I guess we'll talk about shortly.
Great. What is the connection between hypertension and CKD?
So, as I mentioned, chronic kidney disease can cause hypertension, and hypertension can cause CKD. And it's important to break the cycle, whichever way around it is, to treat hypertension, to get it under control. And that's not just to improve your kidney prognosis, but that's obviously also to improve your whole cardiovascular risk. So hypertension not only causes kidney disease, but causes increased risks of strokes and heart attacks and peripheral vascular disease. So it's really important to get a hold of hypertension for all sorts of reasons.
Yeah, absolutely. So are there different types of kidney disease that high blood pressure can cause?
Yes. Hypertension can cause a condition called FSGS, focal segmental glomerulosclerosis, but you don't have to worry too much about that. What that means is kidney scarring caused by damage to the filters in the kidney by excess pressure through those filters, by hypertension. And that can be manifest in tests that are done on patients, including chronic kidney disease, so increased serum creatinine, or proteinuria. If it looks as though that's the condition, then often we don't do a biopsy to prove it because it looks like that's what we think is going on. But if there's a lot of protein in the urine, then sometimes a biopsy is done to prove one way or another what the cause is.
Mm.
The other cause of CKD by hypertension is renovascular disease, and that's where the blood vessels that supply the kidneys are furred up, just like your heart arteries can be furred up if you have angina, which can be caused in part by hypertension as well. And so renovascular disease is the other main kidney condition that is caused by hypertension. But the most important thing to take away really is that no matter what the cause of kidney disease, treating hypertension is of utmost importance. For example, if you have diabetic kidney disease, treating hypertension will be actually more beneficial than treating the diabetes more effectively. Of course, you should do both, of course, but actually, in terms of benefit, treating hypertension in that condition is actually more beneficial than treating the diabetes more aggressively.
Right, absolutely. I think, yeah, sometimes it can be a little bit like, what's the cause of this and what's the cause of that? And it becomes quite complicated. And essentially, but high blood pressure equals bad.
High
And,
blood
and
pressure equals
then,
bad.
yeah, and then you guys can take it from there.
That's
Yeah.
right.
So what are the symptoms of high blood pressure and kidney disease?
So for most people, there won't be any symptoms at all, and this can be a problem. So for most people, there are no symptoms of hypertension and no symptoms of chronic kidney disease. So mild CKD is asymptomatic, and most people don't have any symptoms from CKD until their GFR is less than 20. Some do, but most don't, and that's obviously quite advanced chronic kidney disease. Similarly, most people have no symptoms of hypertension. Some people do get headaches, particularly in the morning. Some people, if the blood pressure is very high, can get blurred vision. But really, both of these conditions are normally asymptomatic. And of course, if you never have your blood pressure checked, that's when we sometimes have people that come to the kidney department with quite advanced kidney disease and very high blood pressure because they've had no symptoms, they felt fine, and all of a sudden something happens, they get checked out, and they've got really, really high blood pressure and quite advanced kidney disease. So as part of people's general health, it is quite a good idea to know what your blood pressure is, even if you feel well.
Yeah, absolutely. So what is involved in the process where a person is specifically referred to a nephrologist? Because like we were saying before, hypertension seems to have various causes and the other way around as well. So yeah, how does, like you were saying, maybe a big thing could happen, but how does a person know how to go to see a doctor, basically?
So normally a referral is made because of hypertension in somebody who perhaps it wasn't expected in. So somebody who's young, or somebody whose blood pressure is really high or resistant to treatment. Those are the sorts of people that we often see in specialist care. GPs often deal with more minor, if I can say that, hypertension. But the assessment is the same as any medical condition. So the doctor will take a history, find out if there are any symptoms, or what are the risk factors for having high blood pressure. So is there a family history of hypertension or not? And then medication. Some medication can predispose people to hypertension. Obviously, other medication treats hypertension, and then other medical or surgical history is taken into account, and then a kind of a formulation is made, and then of course the tests happen. And similarly, the tests are arranged just as in any other investigative algorithm. So first of all, it's blood and urine tests, and you can have some clues from the basic blood tests if there is a hormonal cause to hypertension. But then more commonly, we will actually screen for adrenal and kidney and thyroid, other hormones that can all influence high blood pressure and cause high blood pressure. So what we call secondary hypertension. Secondary hypertension is high blood pressure that has a specific cause. And whereas essential hypertension, which is by far the commonest, has no really one specific cause, but is a really combination of lifestyle and multi-genetic risk factors. And then we also, in some cases, also look for narrowing of the kidney arteries or some adrenal gland imaging to see if there's an anatomical explanation for the high blood pressure. But in the vast majority of cases, it is essential hypertension. But we go through the diagnostic algorithm because if it's important to identify secondary hypertension, so hypertension with a cause, because it will have a specific treatment and may even have a surgical solution if it's an adrenal or a renovascular problem. So that's kind of the process that we go through for everybody. But part of the assessment, of course, also is that lifestyle interrogation, if you like, and so what can be done by that person to help themselves that isn't pharmacological intervention. That will be an important part of that consultation.
Great. Okay, thank you. How is kidney disease caused by hypertension and hypertension caused by kidney disease treated? I had to really think then.
So chronic kidney disease can cause hypertension by a number of different ways. Not fully understood, if we're honest, but a number of different ways. So as if you have a particular kidney condition, let's just say IgA nephropathy, which is a common cause of CKD. How does that cause hypertension? Well, as the CKD progresses, hypertension usually gets worse, and that's because the kidneys aren't getting rid of salt and water properly. So the retention of salt and water by the kidneys can predispose a person to have hypertension. Also, the kidneys make a hormone called renin, and as that level of renin goes up, that causes hypertension through a system called the renin-angiotensin system. And then the third way that the kidneys can cause hypertension is by activating the sympathetic nervous system. And it's not completely understood how that happens, but we do know that in some cases, ablating the sympathetic nervous system, so killing the nerves that both supply and come from the kidneys, in this system, can treat hypertension in a very small number of patients. So it's really those three things: salt and water retention, increased renin secretion, and the sympathetic nervous system activation that causes hypertension by the kidneys. There are probably some other ways as well, but those are the three things that we understand. And I think earlier on we covered how hypertension itself causes kidney disease, and that's primarily by renovascular disease, and in some people, scarring and FSGS.
Right, okay. Fantastic. So how can patients manage the condition, their symptoms, in their day-to-day lives?
Yeah, so I think it's really important that if a patient has been found to have hypertension, that they kind of own it as an issue, as a thing. It's a thing in their lives. People often weigh themselves every week, sometimes more often. People go for a run. People have these lifestyle adjustments. But once you've got CKD and or hypertension, your blood pressure really should be one of those things that you know about. It's part of your health. It's part of your healthy lifestyle. So you're gonna own the problem. You don't overkill. So some people have come in with spreadsheets of blood pressure measured 1 million times a day, and that's not really helpful in my belief. So you need to buy a blood pressure monitor, number one. So you know what your blood pressure is. You know what it is when you wake up, on average. You know what it is during the day, and occasionally what it is in the evening. So you've got a rough idea about how your blood pressure changes during the day, and if you take medication, how the medication influences your blood pressure. So it's important to personalize it for you, because everybody is different. So first of all is to own the numbers, understand the numbers, what's going on in my body, what activity do I do that changes my blood pressure. So it's very a personalized approach to managing this. So if I know that having a quadruple Americano, espresso rather, increases my blood pressure, then maybe I don't have a quadruple Americano all the time, and maybe I should be having a green tea or something.
Yeah.
So there's the ownership of the problem, number one. And then there's, what do I do about it? So there's things that by owning the problem, you will identify some risk factors, but we know that in almost every case, reducing salt intake is going to be important. And that's because, particularly if you have CKD, your kidneys aren't getting rid of it properly. So you don't want to ingest too much, because they're not going to get rid of it properly. But not only that, but quite a few of the medications, particularly the ACE inhibitors, which is a very, very commonly used class of drug in hypertension and CKD, work much, much better in a low salt environment. So it's really important to reduce salt in your diet. What does that mean? Well, you can look at the numbers, but in many cases, it's really just not adding salt to food at the table, reducing the amount of processed food that you buy, reducing the amount of bread that you eat. So it's really a healthy diet that anybody knows is healthy, but finds it difficult to stick to often. So those are the main things. And then, so I guess on the weight loss, on the diet question, it's are you overweight? If you're overweight, it's obvious what you need to do, right? To try and lose weight. If you're overweight and you have sleep apnea, if you know what that is, then that if addressing sleep apnea can actually improve your blood pressure. So there are lots of things that you can do in lifestyle, even before we get onto medication, to try and improve your blood pressure.
Yeah, that's good to know that people are able to do that.
Yeah, so I mean, an anecdote I sometimes use is that one of my friends from university was diagnosed with hypertension at a young age, and he cut salt out of his diet completely, and
Wow.
he managed to reduce his blood pressure pretty well,
Yeah,
but life was so terrible on zero salt that he
yeah,
couldn't quite stick with it. So he decided that actually he would reduce his salt, but would have to take medication
yeah.
to get his blood pressure to where it needed to be. So you can do it,
Mm.
um, but sometimes. Life is for living, and so you have to have this balance between, what's realistic and healthy,
Mhm.
and then there's obviously the ideal as well.
Yeah, absolutely, absolutely. So, final question, can kidney damage from high blood pressure be reversed?
Yeah. So, and the answer is sometimes.
Okay.
So, yeah. So, more often than not, unfortunately, the answer is no. So, if you have a very slow burn of hypertension causing CKD, then the chances of reversing it significantly is very low. But the chances of delaying the progression of kidney disease by treating hypertension and other risk factors is very high. So even if you can't make things a lot better, um, at least you can slow things down, and obviously that's really important. One of the key aims in nephrology, at least, is if you find somebody who appears to have progressive chronic kidney disease, is to slow down the progression as much as is humanly possible, obviously to reduce the risk of having to require dialysis or a kidney transplant later in life. And so that's obviously what most of our work is about. So in most cases, unfortunately, the answer is no, but it's still really important to address it for the future.
Yeah.
In some cases of a sort of what we call accelerated hypertension, and so really high blood pressure, we're in an acute situation. You can have some patients with really quite a lot of kidney damage that's identified on blood tests, and then regulating the blood pressure in that situation can get some degree of improvement in kidney function. So you may be able to improve from let's just say 20% kidney function to, I don't know, 35% kidney function in an acute phase of hypertension. So that can happen, but not always. And some people may arrive at 20% and stay at 20%, but at least by treating the blood pressure, all the other risk factors, all of the other risks of having hypertension are then mitigated. So unfortunately, yeah, the answer is no in most cases.
Well, absolutely. I think it's just obviously the main thing is very important to see your doctor about it, and get it treated expertly.
Agreed.
Yes. Okay, so that's it for today. And thank you so much. We really, really appreciate speaking to you and finding out all about it. It's helped me a lot. So if you're looking for expert nephrology treatment for conditions like CKD caused by hypertension, visit Dr. Games' profile at topdoctors.co.uk for more information.
Thanks very much.
Thank you.